Hello everyone, I'm Dong Yuzhen from Department of Gastroenterology, the First Hospital of China Medical University. In this part, we will learn the clinical manifestation of hepatic cirrhosis. Cirrhosis usually starts from a hidden disease and develops slowly. Clinically, cirrhosis can be divided into compensatory and decompensatory stages. In compensatory stage, most of the patients have no symptom or mild symptoms, such as fatigue, anorexia, abdominal discomfort, dyspepsia, diarrhea, and so on. Most of them are intermittent. They often appear due to fatigue and mental tension. Rest and medication can relieve them. In the decompensatory stage of liver cirrhosis, there are mainly two kinds of clinical manifestations: liver dysfunction and portal hypertension. Dyspepsia, anorexia, nausea, easy diarrhea after eating meat, mostly related to gastrointestinal contraction, edema, and intestinal flora imbalance when portal hypertension. Malnutrition, general condition is poor. Emaciated, fatigue, listless. Jaundice, the skin and sclera were yellow, stained, and urine color was deepened. The continuous aggravation of jaundice indicates progressive necrosis of hepatocytes. Hemorrhage and anemia. It often has nasal cavity, gingival bleeding, skin ecchymosis, gastrointestinal bleeding, etc., which is related to the reduction of liver synthetic coagulation factor and hypertension. Endocrine disorders. Common estrogen increased, androgen decreased. Male patients showed hyposexual desire, breast development, and testicular atrophy. Female patients showed menstrual disorders, amenorrhea, infertility, and so on. The appearance of liver palms and spider nevus is relative to the increase of estrogen. In addition, can have adrenal cortex function drop, antidiuretic hormone increase, thyroxine reduced, irregular low fever. The deactivation of heat-generating factors is reduced, resulting in irregular low heat. It can also be caused by secondary infection. Hypoproteinemia, caused by the decrease of liver synthesis function. It is involved in the inflammation of ascites. The patient may have lower extremity edema. Portal hypertension has three main manifestations: cholesterol circulation, splenomegaly and hypersplenism, and ascites. Esophageal and gastric varices are the most common complications of portal hypertension due to cirrhosis. Abdominal wall varicose vein physical examination showed caput medusa. Hemorrhoid varicose, hemorrhoid bleeding may occur. Retroperitoneal anastomosis are called Ritzer's veins. Splenic and renal shunt. The splenic vein, gastric vein, and other branches of portal vein can communicate with left renal vein to form splenorenal shunt. Splenomegaly is an early sign of portal hypertension in the hepatic cirrhosis. The splenomegaly can stimulate the proliferation of monocyte macrophages and hypersplenism, which leads to the decrease of peripheral blood cells in different degrees, anemia and hemorrhage, and is easy to be complicated with infection. Ascites is the common result of liver dysfunction and portal hypertension, and it is one of the most prominent clinical manifestations in decompensate cirrhosis. The patient often describe abdominal distension. A large amount of ascites cause abdominal distension, such as frog belly, which may lead to umbilical hernia. The diaphragm move up, eliminate movement. Dyspnea and palpitation may occur. We learn about the mechanism of ascites formation, which has the following 5 aspects. First is the portal hypertension. Increased hydrostatic pressure of abdominal visceral vascular bed, reduced absorption of tissue fluid, and leakage into the abdominal cavity. This is the decisive factor for the formation of ascites. Second, when serum albumin is lower than 30 grams per liter, the osmotic pressure of plasma coli decreased, and the fluid in capillary leaks into abdominal cavity or tissue space. The third, the results showed that the effective circulation blood volume was insufficient. Renal blood flow was decreased. Renin-angiotensin system was activated. The glomerular filtration rate was decreased. Sodium excretion and urine output were decreased. The fourth, the liver has reduced inactivation of aldosterone and antidiuretic hormone, resulting in the increase of secondary aldosterone and antidiuretic hormone, resulting in retention of water and sodium. The fifth, the amount of liver lymph exceeds the capacity of lymph circulation, which leads to excessive lymph production and leakage into abdominal cavity. Okay, that's all for this section. Thank you for listening.